In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
Wabah virus corona bisa kita hindari bila mereka yang terkena penyakit ini melakukan isolasi diri. Tidak semua pasien corona harus dirawat di rumah sakit. Mereka yang tidak termasuk kelompok rentan cukup melakukan isolasi diri di rumah. Protokol isolasi diri sendiri dalam penanganan COVID-19. Mengapa orang yang diduga tertular COVID-19 diisolasi setidaknya 14 hari? Gejala COVID-19 biasanya muncul dalam rentang 1-14 hari berupa batuk, demam, atau sesak nafas. Dalam selang waktu itu, kondisi orang diduga terinfeksi COVID-19 diisolasi dan dipantau di rumah sakit, rumah, atau tempat lain. Untuk memastikan infeksi, akan dilakukan tes beberapa kali. Apabila Anda bukan kelompok rentan seperti lansia atau memiliki penyakit kronis lain seperti diabetes, jantung, kanker, penyakit paru kronik, AIDS, penyakit autoimun, dan sejenisnya, maka Anda dapat secara sukarela atau berdasarkan rekomendasi petugas kesehatan melakukan isolasi mandiri. Apakah isolasi mandiri itu? Isolasi mandiri adalah upaya mencegah penyebaran COVID-19 dengan berdiam diri di rumah sambil memantau kondisi diri kita, seraya tetap menjaga jarak aman dari orang sekitar atau keluarga. Siapa yang perlu melakukan isolasi mandiri? Siapapun yang memiliki gejala sakit seperti demam, batuk atau pilek, nyeri tenggorokan, atau gejala penyakit pernafasan lainnya, atau termasuk dalam kelompok orang dalam pemantauan atau ODP, yaitu orang yang pernah berkontak erat dengan pasien positif COVID-19 dan atau orang dengan riwayat perjalanan dari negara atau transmisi lokal COVID-19. Berapa lama waktu isolasi diri? Setidaknya selama 14 hari sampai hasil pemeriksaan sampel di laboratorium diketahui. Apa yang perlu dilakukan saat isolasi mandiri? Tinggal di rumah dan jangan keluar, kecuali untuk mencari pertolongan medis. Sebisa mungkin, gunakan kamar terpisah dan selalu jaga jarak setidaknya 1 meter dari anggota keluarga lain. Selalu gunakan masker selama masa isolasi diri. Ganti masker secara rutin apabila basah atau kotor. Lakukan pengukuran suhu harian dan observasi gejala seperti batuk atau kesulitan bernafas. Hindari berbagi peralatan makan seperti piring, sendok, garpu, dan gelas, perlengkapan mandi seperti handuk atau sikat gigi, dan juga benda berbahan kain, misalnya pakaian atau selimut. Terapkan perilaku hidup bersih dan sehat seperti makan makanan bergizi, rutin mencuci tangan dengan sabun dan air mengalir, serta melakukan etika batuk dan bersih. Upayakan berada di ruang terbuka dan berjemur sinar matahari setiap pagi. Jaga kebersihan rumah dengan cairan disinfektan, terutama untuk area atau permukaan yang sering tersentuh tangan. Hubungi segera fasilitas layanan kesehatan bila sakit memburuk, seperti mengalami sesak nafas. Apa yang tidak boleh dilakukan saat isolasi mandiri? Tidak boleh keluar rumah, termasuk untuk bekerja, apalagi ke ruang publik. Bila sangat terpaksa harus keluar, gunakan masker dan hindari transportasi publik atau tempat ramai. Tidak boleh berbagi alat makan, mandi, dan pakaian bersama anggota keluarga lainnya. Cuci peralatan makan dan pakaian secara mandiri, terpisah dari anggota keluarga lain. Bila harus berbagi kamar mandi atau mesin cuci pakaian, maka bersihkan dengan desinfektan setelah dipakai. Bagaimana menjaga pertahanan tubuh selama masa isolasi mandiri? Tetap terapkan pola hidup sehat, antara lain dengan makan makanan bergizi seimbang, perbanyak buah dan sayur, istirahat yang cukup, lakukan olahraga ringan, dan hindari merokok atau minum alkohol. Isolasi mandiri bukanlah sesuatu yang sulit, namun membutuhkan komitmen baik dari diri sendiri maupun keluarga dan orang terdekat. Orang yang menjalani isolasi dapat mengalami kesepian, kekhawatiran, dan ketidaknyamanan saat mengalami gejala sakit. Maka mereka perlu dibantu, didukung, dan diberi semangat. Mari saling berempati, perkuat solidaritas, dan bersama kita melawan corona.